The diseases that were the biggest killers were dysentery, which is caused by Shigella, typhoid fever, which is caused by Salmonella typhi, ague, which is caused by mosquitoes, yellow fever, which is caused by flavivirus, malaria, which is caused by Plasmodium parasite, scurvy is caused by vitamin C deficiency, pneumonia is caused by Streptococcus pneumonia, tuberculosis is caused by Mycobacterium, smallpox is caused by variola. Some of the medical procedures that added to the medical problems were both armies were willing to accept anyone who considered themselves a physician. Most of the men were young and had to read a manual on how to operate. Infection was a major problem because if a patient didn't have pus, they would transfer it from someone who did. Doctors didn't sterilize their tools. Also, surgeons used their fingers to look for bullets. Often, operating tables were a barn door supported by two barrels. Doctors wore no mask or hats. The tables were not cleaned after each patient. Bacteria played a major role in the loss of soldiers because infection was the number one cause of death of soldiers after surgery because of the unsanitary environment they were operated in. The first antibiotic was penicillin, and it was discovered by Alexander Fleming in the 1920s on accident when mold had grown on the same dish of bacteria and it had worn down. It cured battlefield wound infections and pneumonia during World War II. The antibiotic was used to cure very serious infections. Now, at least 150 million antibiotic prescriptions are written in the U.S. The antibiotic was overused because of a problem known as antibiotic resistance. It affects the usefulness of the antibiotic. The impact it made was many people were healed, but also many people became caught in a new outbreak. It kills infectious bacteria and Staphylococcus aureus bacteria. Other antibiotics created after penicillin were streptomycin, cephalosporins, grisavulin, and neomycin. Hand hygiene became a common practice in the medical health care system in 1840. Hand hygiene is important in reducing infections because washing your hands and keeping them clean helps reduce the amount of bacteria and can minimize healthcare associated infections. Hand hygiene is very important during other times as well. A major field where hand hygiene is important is the food industry, because washing your hands prevents cross-contamination, foodborne illness, and many other things. To wash your hands, you must first turn on the water and get your hands wet. You must then apply the soap and lather your hands for a good 20 to 30 seconds. And make sure you get underneath your fingernails and in between your fingers and up your forearms. And when you're all done, make sure you clean off your hands really well. Turn off the water and dry your hands. Antibiotics are types of medications that destroy or slow down the growth of bacteria. Antibiotics are used to treat infections caused by bacteria. 5 different antibiotics are penicillin, which cures syphilis, sulfonamides, which cures infections, monobactams, which cures intra-abdominal infections, carbapenems, which cures intra-abdominal infections, streptogramins, which cures BRSA and VRE. Other precautions are maintaining a healthy immune system and keeping a well-balanced diet. There are good bacteria, such as probiotics found in yogurt, Lactobacillus acidophilus found in the intestines where it aids in the digestion of food. Bifidobacterium bifidum can help to repair stomach ulcers caused by other bacteria. Humans benefit from good bacteria because good bacteria keeps the bad bacteria from multiplying and causing illness. Good bacteria strengthens the mucosal tissue that lines the inside of the intestines. Good bacteria breaks down complex sugars, proteins, and fats so your body can absorb their energy during food digestion. We cannot live without these bacteria because they do many important things and keep our body moving. Antibiotic resistance is the ability of a microorganism to withstand the effects of an antibiotic. A concern about antibiotic resistance is the bad bacteria kills off some of the good bacteria, so the bad bacteria can multiply and transfer their drug resistance to other bacteria, worsening the problem. Bacteria is becoming resistant to antibiotics in order to live and multiply and continue breeding with their genes. You can prevent resistance to antibiotics by avoiding infections, and when you use antibiotics, use them properly. Keep hands clean. A few ways in which bacteria has become antibiotic resistant is by a change of genetics or mutation, and the ability to swap genes means the resistant bacteria can be shared and spread. It has not been proven that products containing antibacteria are better at preventing the spread of infection compared to ones that don't. Their use has not been determined to cause a health consequence. Some of the common antibacterial products are soaps and detergents, disinfectants, mouthwashes, and garbage bags. Some of the names of bacteria that have become antibiotic resistant are Staphylococcus aureus, Enterococcus, and Mycobacterium tuberculosis. They are extremely dangerous because they have become resistant to almost all of the easily available antibiotics, and the bacteria are able to cause serious disease. They spread readily because they are resistant to any antibiotic that tries to cure them. We can control this problem by minimizing unnecessary prescription of antibiotics and practicing good hygiene. In the future, it'll be more of a problem because more people will be asking for antibiotics but not taking the safety precautions. We are the cause of the problem because more and more people think medicine is the solution for everything, and they continue to be prescribed medication that is unnecessary. It can be solved by putting a limit on medication that is prescribed for the wrong reason. Probiotics help bolster the immune system throughout the body. They help with the GI tract. They're also used to cure young and elderly patients with infectious illnesses.